hearing that phrase, "you have cancer," has got to be overwhelming. You need a group of professionals that's going to change that overwhelming into something that's manageable.
It needs an entire team, and we have that team in place.
I would say we have tried to create a model of comprehensive cancer care here.
In the whole city, there is not a setting that you have the radiation oncologist and the medical oncologist work under the same roof.
A patient can truly come here and have every aspect of their cancer care taken care of and all of their needs met.
So it makes it very convenient and easy for the patients to be treated. I feel that they get the best possible care that is done in a very coordinated and efficient manner.
I think having medical oncology here with radiation oncology, along with our staff, nurses and nurse practitioners and therapists, make this the absolute leading cancer center in Lincoln, Nebraska.
Well, I think we have a tremendous staff.
We've tried to create a warm, friendly environment and fill it with compassionate, caring people.
From the receptionist to the laboratory to the nurses, all the way to myself. Everybody is committed to doing what needs to be done for these individual patients.
We are here to listen to you. We're here to see your needs. When you come to our clinic, you're not just a disease, but you are a person. And we want to treat you not just for the disease, but as a person.
We're going to try harder to take care of your cancer and to do everything we possibly can to give you the best care.
We try to provide therapy in such a way that if I have a patient who wants a second opinion and they go to Mayo Clinic or some referral center, that they will say, yes, that's the best therapy. And if we don't have that, then we will look for it or refer patients to more specialized places.
We do image-guided radiation therapy here with a Varian linear accelerator. We also installed a brain lab here, which means that during a treatment we can see where the patient is while the beam is on, and that basically makes us quite special in Lincoln.
We have a lot of trials available here that are allowing us to provide new technologies and new drugs that are exciting and are providing patients with longer lives and less pain and more comfort. And
we are here to deliver the best treatment for you. By coming here, being our patients, we want you to have the confidence that you are getting the best treatment. And with the best treatment, you can hope for the best outcome.
I also remember one young woman who was actually a nurse who had a kind of a rare ovarian tumor. And I know she'd been told somewhere that, well, you have to have surgery and a hysterectomy. And I said, no, this is the kind of tumor that you can successfully treat with chemotherapy, which was done, and subsequently her cancer went away. She's remained in remission. It's been well over at least 10 years. I don't follow her anymore, and she went on and had 2 children, and she sends me Christmas cards with their picture and how they've grown. So that's something that I think is really, really nice.
I remember being struck by, we'll call him, his name was Brian. He came to me with a pretty aggressive lymphoma. And I remember telling Brian that on the first day I met him that we're going to beat this thing. And it was about a year later, after all the lymphoma was gone, I went to actually watch my wife in this charity bike race. And so standing along the sidelines there, and there went Brian by with a group of his friends there, and he yelled out, "There's the guy that saved my life." And he stretched the truth a little bit. There was really a team taking care of him, and Brian did all the hard work. But it was pretty neat just to see Brian get back to his just being active and what he used to do before he was sick.
I would say one thing that I find the most rewarding is being out in the community and going to events like Light the Night or Relay for Life, and seeing staff from my clinic participate in those things, and seeing patients that have been treated here, and seeing them come up and embrace and smile and laugh and sometimes cry about the things that they've been through. We take leading cancer care seriously.
To me, that means giving the best possible, most currently available, and most technically demanding treatments here in Lincoln, Nebraska.
It's the people here that I think make our difference.
I take leading cancer care seriously.
I think leading cancer care is a commitment. And with commitment, you promise that you will do the hard work. To lead cancer care is not a simple statement. It involves responsibility. It involves dedications. And it involves a promise that I would always stay ahead of the game. And that's what I want you to know.